3, 2, 1, you're on.
And good morning, ladies and gentlemen. Welcome to the Board of County Commissioners Board work session for Wednesday, December 16th, 2020. The topic today is Puget Sound Energy COVID-19 Community Data Project. If you'd like to join in by Zoom, no, not by Zoom, if you'd like to join in by conference call to listen, the number is 360-252-9020, and the pin is 1234. I'm John Hutchings, the chair of the board, and we also have Vice Chair Commissioner Ty Menser and Commissioner Gary Edwards in the House, County Manager Ramiro Chavez, and we're also joined by the Thurston County Health Officer, Dr. Dimiana Malik, and PHSS Director Shelley Slaughter, and we have Kelsey Hulse representing PSC here. And we have just joining Assistant County Manager Robin Campbell. So go ahead, Ramiro, please.
Yeah, thank you, Commissioners. This is a very cool project that Puget Sound Energy embarked when the pandemic hit us all. And Kelsey has been very kind to giving us some data on a monthly basis via email as to what pertains some of the effects and impacts to Thurston County community as a result of the COVID-19 pandemic. But I thought it was a good idea just to invite her and walk you through perhaps the purpose and intent of embarking on this project and what elements we can get out of there to perhaps do better. So really, it's Kelsey's show right now.
All right, Kelsey, welcome.
Thank you so much. It's wonderful to see your faces. Of course, would be nicer in person, but I'll take this too. I appreciate you all taking the time to chat a little bit about this. I'm pretty excited about this project. Well, to step back, Kelsey Hulse, Puget Sound Energy. PSC has taken this pandemic really seriously from the beginning, and I just joked a little bit about the fact that we were told to go home on March 4th and not to come back. And that's partly or largely because we take very seriously our obligation and our purpose, which is providing safe, reliable power to our 1 million electric customers across the service territory. So that is our #1 priority, keeping our employees safe, keeping our customers safe, and continuing to provide that critical service. As we moved later into the pandemic, it became apparent to us that we were seeing a lot of information about national trends and a lot of information about statewide trends, but that we weren't seeing a ton of what we felt was actionable information that was statistically relevant at the local level. And that was really where kind of the genesis of this idea came from, was how can we leverage the resources that we have to provide something that is valuable and useful to the communities that we serve. So this project, we began surveying folks in August. Well, our contractor Ellucid began surveying folks in August. So the first report that you received was in September, and you've received monthly reports since then. And I just passed along, we just got the December report from the previous month's surveying. I think it's really helpful to kind of see how sentiments are changing over time. So what this seeks to do, we do this in every county where PSC operates right now. But the thing that was most attractive to us about this technology that Ellucid uses is that we are getting a statistically relevant sample, and their technology will actually basically self-correct if they see overrepresentation from any segment of the community that isn't consistent with not survey data. Every 10 years we do a
census.
Thank you. That word just flew out of my mind. So the Ellucid uses the census data to make sure that the results that they're getting are tracking with that age, gender, a variety of different demographics. And so it allows them to kind of self-correct if they see something out of the norm. So that's sort of the purpose and the intent. It's also helpful to us as a community to understand where our customers are, how they're thinking about things, what's important to them, and just generally kind of feel like we can have our finger on the pulse of how people are handling the current situation. So that's kind of purpose and intent. If there aren't any questions, I can walk you guys through some of the results we've gotten.
We have, I'll turn to my seatmates if you have any questions. And this is only designed for 30 minutes, so there's a lot of data. So I'm going to give you sufficient time, Kelsey, to get through whatever you need to get through, what you're planning on getting through. But I'll ask Commissioner Menser, any questions or comments up front?
Not at all. No, I've been reading the emails that they come in, so I'm tracking what this is about.
Yeah, as I have. Commissioner Edwards?
Yeah, I will ask a question because I just, it's kind of interesting to me, and it's the one that says, it's on the second page, when do you wear a mask or face covering over your nose or mouth? And then every time and all that. So that question, and then the one underneath of it, police arrest, citation, fine, warning. Could you just explain a little bit those two issues, where you're going with that and what you really found with all the lines and everything laid out in a layman's terms for me?
Sure. So I am going to share my screen because the best, and I just realized I still have too many things open. The best tool that is available to you guys is this online dashboard. Can you guys see the Washington State at the top of the page? Online dashboard, perfect. And so what this allows you to do, the documents that I sent are essentially snapshots from the current month. So Ellucid tracks all these questions across Washington State, and then they're also tracking similar data across the country, so they can kind of compare, how Washington fits into that broader picture as well. But this dashboard here allows you to delve more deeply into Thurston County specifically. You can see, so down here you've got these buttons, so you can change between counties, right? We can look at Lewis County, back to Thurston County, or clicking this overall will give you the picture of kind of where everyone is at on average. The other thing that this allows you to do is you can remove kind of outliers. So if you say, okay, I want to know, this is, how do you assess the risk of serious harm to you or a loved one? I want to know how many people think that's a very serious risk. You can eliminate, I'm sorry about that. You can take this one off, and just see, how many folks are in that 3, 4, 5 category. So that's pretty helpful. This allows you to kind of manipulate the data in whatever way you'd like to see it, and it's useful to you, and also shows that over time, which I think is really helpful. So these questions came largely from us, from PSE. We kind of our team thought through what would be useful to know. We tested this with a variety of public officials across the service territory and said, is there anything we're missing? Is there anything that you'd like to see that we don't have here? And in fact, there are a couple questions in here that have been added later in the process because we had folks come back to us and say, what we'd really like to know is, X. So this is, again, how you assess the risk of serious harm to you or a loved one due to the coronavirus pandemic. And it's worth noting, I'm going to switch screens here just for a minute. This is the summary that I sent this morning, this executive summary. And so this kind of notes trends that are happening across the service territory, across PSE service territory, and then does highlight if there are any anomalies. So you'll note that first bullet point that we've actually seen a significant increase in the number of people who perceive COVID-19 as a serious risk. We have also seen a slight increase in people's willingness to take a COVID-19 vaccine, although interestingly enough, Thurston County is actually the lowest county right now in the number of people who are reporting that they will take a vaccine when it becomes available to them. I would say some encouraging data is this next bullet point around Thanksgiving behavior. Most people did stay home and stay within their, with their household members for Thanksgiving, which is pretty great, I think. And then asked about December holiday plans. So while less people are planning to stay home, there are still significantly more planning to stay home than would in a typical year.
Kelsey, the thing I was interested in is because the mask issue becomes, is so controversial. I mean, a lot of people, that's an issue. And I'm interested in the schools, and that's why I asked about those couple specific ones. I didn't go to the school yet because we haven't got the mask covering one or the police involvement one. I'm just trying to get what this is actually telling us. That's what I just picked out a couple to see if you could tell us what that means.
Fair question, and we're getting there next. So there are a couple bullets in here about mask enforcement and school openings. It's important to remember that most of these questions were constructed and started being asked in August, right, and reported in September. So at that point, a lot of counties and the state were kind of grappling with, are mask mandates working? How are people feeling about them? Schools were going back into session. So one of the questions that we really wanted to ask was how, I'm going to switch the screens again here, but how prepared, forgive me as I scroll down here, how prepared do you feel that schools are to, here we go, how confident are you that local schools are prepared to teach students and support learning during this COVID-19 pandemic? So that was kind of part of the motivation behind both the mask question and the schools question, those were issues that both local government and state government were grappling with at that time. And so that's why we started asking those questions to see how people felt about it. I'll go back up to the mask one here. And that was, so again, this is just data for Thurston County. And so what we wanted to find out is, anecdotally, we could see people wearing masks, but where were they wearing them and where weren't they? And early on in the questions, for instance, we saw that people were wearing them very frequently at the grocery store, but not so frequently on buses or transit, which was sort of an interesting anomaly. But then that allows for some proactive messaging from public health organizations, from transit authorities to say, hey, we would like you to wear a mask on our buses as well. And so that's one way that information was used. Further, because these questions came about sort of at the beginning of the mask mandates, there was a lot of debate about, or there seemed to be a lot of public debate about what does a mask mandate mean, right? We're asking people to wear masks wherever they go, but then what if they don't? Or should that be enforced in any particular way? And so that's when we started asking that, or that's why we added that second question around, what do you think should happen if somebody doesn't wear a mask? Again, not because we're going to enforce anything in any way, right? We have our own internal standards for our employees, but beyond that, it was just a way to kind of validate, hopefully, the anecdotal information that public officials were receiving about masks in particular.
Oh, okay, well then, what do the numbers mean off to the left? Is that a percentage of people that you talked with?
Is this the page you're looking at, Commissioner?
Well, I can't see your layout.
Okay.
It's tough to follow. I'm looking at page 2 on the handout that I was given. The pages aren't numbered, but Washington State, and then I'm looking on page 2. When do you wear a mask or face covering over your nose or mouth? I'm trying to come up with answers there, what the public felt about that. And the next question down is most states have required or recommended. I'm just trying to figure out exactly what that is. Those two questions. I just focused on those two as an example that maybe you could give us.
Mm-hmm. Yeah, so the page I'm sharing now is what we call the crosstabs of the data that shows kind of where all the different counties sit based on the answers to that question. So in Thurston County, I highlighted here that the strongest mask participation wearing is happening at the grocery store right now. If you look at that dashboard, you can kind of see where those have gone up and down over time. For instance, people are wearing masks less frequently when they're exercising in public or social distance hangout in a public area. Those are two areas where we used to see a higher number of people wearing masks. Now we're seeing a lower number. And that, I don't really want to speculate on exactly why that may be, but I think a big part of this is just as more information becomes available about how the virus works, I think we're seeing a little bit of a shift in people's behavior as a result.
Kelsey, isn't the answer to his question yes? It's a percentage on the left.
Yeah, thank you.
Just
I
to
think the
clarify.
numbers on the left is that a matter of percentage or the number of responders? For instance, you touch base on the wearing a mask. On the y-axis, you have 10, 20, 30, 40, 50, 60, 70, 80, 90. Is that percentage or is that number of respondents?
I'm not.
I believe that's Commissioner Edwards were asking.
Yes, sir, that
You're
was
talking
it.
here on these diagrams on the left-hand side where we've got the 0, 10, 20, 30, 40, 50.
Yeah,
Yeah.
what does numbers mean? Is that percentage or number of individuals who have responded?
That is a percentage, I believe.
This one, obviously, they were able to answer multiple yeses, but there's other ones you've shown where it adds up exactly to 100. So I'm assuming.
Yeah. Oh, thank you very much for that, Commissioner Menser. Yeah, that's a great point. So on this question, for instance, when are you wearing a mask? There's not one answer available, right? People are answering for each of those categories, for each of those places, right? At the grocery store, every time you leave your house, on transit, yes or no, are you wearing a mask? So that number won't add up to 100%.
Yeah, that makes sense. So it's multiple choice.
Correct.
Yeah, okay. That answers your question.
I'm fine, yeah, I'm good.
And so again, that's why the enforcement question came around, is just as people were rolling out mandates, there was a question of, what would enforcement look like around that? How would you presume to get people to comply, excuse me. And so that's where you see this data here. I'm just going to scroll down to the schools. So how confident are you that local schools are prepared to teach students and support learning? That again is a testament to the snapshot in time since we started this in August, reported first in September. And so most school districts were still grappling with exactly what they were going to do and how, and this was thought to be one way to inform them. So I've also sent this to superintendents in our community just to kind of let them know what we're finding out to the extent that that information is helpful to them. So I'm going to go back to this summary for just a moment, just to highlight this is probably the best overview for what the data is doing, particularly over time. We are seeing two points that I think are interesting, particularly for public officials, are that there does seem to be a lack of trust, both in public officials writ large and in the school system, in terms of how community members are feeling about the decisions that are being made around those two institutions. So schools, again, about half, a little less than half of respondents are confident in their school's ability to teach and support education. That's remaining fairly stable from the previous month. Visiting businesses, more people, we're seeing an upward trend in the number of people who are comfortable visiting businesses, which is particularly interesting to me. And then lastly, so as I mentioned before, we have added some questions as kind of the environment has changed. So this last bullet point, Washington's contact tracing app, asking if people are likely to use it. And again, it's pretty split. We're seeing about 50-50, with Thurston County being either the lowest or one of the lowest in terms of the number of people who are willing to use that contact tracing app on their phones.
Oh, so your screen's not moving. You're talking about different graphs, but just so you know, I don't know if you were trying to move the screen.
I think she's moving through the executive summary, the bullet points on the executive summary. And
I am.
Amy just provided you a copy of that.
My apologies.
Okay, well, I see the graphs in the packet, but
Let me.
Amy didn't give you a copy of the executive summary. Let me walk over.
yeah, I got it.
Okay.
But maybe I'm a data nerd, but I like to see the colored graphs that are in the packet, and that correspond to what she's talking about.
Okay. Let's see. So we'll just swing back up to the top and cover this quickly. But as I said, happy to answer any questions. And first and foremost, I'm available to you guys. We're available to you guys if you have any questions at any point on any of this, or if you have any feedback on questions you'd like to see asked. We have committed to do this at least through the first quarter next year. Obviously, we will reevaluate as the situation progresses, but happy to tweak things or shift things if there's something that we can do to make this more useful. So we talked about the risk of serious harm, COVID-19 vaccine. And again, these are all Thurston lines that are on here. COVID-19 vaccine we added in October when there started to be, or added for survey in September, reported in October when there started to be more news about a vaccine becoming available. The number of times people are leaving their house per week. One of the things that I've noticed about the data, which I found interesting, is that it tends to fluctuate the most at the outsides, right? The people who aren't leaving at all and the people who are leaving the most are where we're seeing fluctuation over time. Though there's a significant percentage of folks in this kind of 3 to 4 times a week time period that is remaining consistent over time. And again, I wouldn't want to speculate on exactly why that is, but I think it is interesting. We talked at length about the mask usage. And mask enforcement, which we found, for the most part, folks don't think there should be significant enforcement, and that number you can see on this green line has really increased in the last month, interestingly enough. And the number of people who would have supported a warning for first offense and fine for subsequent offenses also went down pretty dramatically. Level of confidence that the economy will recover in the next 6 months. That blue line, that top blue line, is the number of people who have no confidence or aren't at all confident that the economy will recover in 6 months. We've seen that increase. So number 1 and 2 there, and again, you can click these and remove if you want to see the folks who are not confident. We're seeing those numbers increase there versus the reverse. If we take these guys out, these are the folks who would be either neutral or very confident. So those numbers have decreased in the last month. This question, how would you describe your ability to pay your rent or mortgage as a result of the crisis? I think is interesting. The number of people reporting that their ability to pay has not changed due to the crisis has been decreasing since October. So we saw a decrease over the last 2 months, which may indicate that, that ability to pay their rent or mortgage is becoming more difficult as the pandemic wears on. I don't think that's surprising, but it's interesting to see it in the data. And then small increases in the will not be able to pay, will be able to pay, but will have to dip into savings, or do not pay rent or mortgage. The local schools data, in some ways, has been kind of all over the place, which is sort of interesting. We have seen this very confident number. I'm just going to remove these for a second. This very confident number has gone up since October, which I think is a testament to the work that the schools have been doing to adapt to the environment that they've found themselves in. At the same time, those softer sentiments in the middle have been, again, those people who would answer that a 4 out of 5 has decreased dramatically, and the 3 is kind of down and up. So,
Hey, Kelsey, we have just about a minute and a half left remaining.
Perfect. So I would encourage you guys again to use this, to poke around in this dashboard. It's available to you and linked in every report that I've sent. I will resend the most recent results around. If you have any questions, happy to answer them. And if you have any questions on the technology or methodology, we can also put you in touch with somebody from Ellucid, the company that does that surveying for us. But I just in closing would say, you know, we're proud of this project. We're happy to be able to offer data that we hope is useful to you guys as you are making decisions in this really, really complicated and challenging environment. So if there's anything we can do to make this more useful to you, I hope you'll reach out and let me know. Thank you. I like the executive summary and the comparison with the other counties. Found it very interesting. The psychology of these folks. Let me ask either Dr. Damiana or Shelley, if you have any questions, jump in. We just have a moments left.
I don't have any questions. I'm looking forward to reading the reports in more detail and checking out that dashboard. Thank you.
Okay, Dr. A, anything?
I know it's always good to get a snapshot, especially one that we can see over time, where we can see what folks are thinking, you know, in our community and how it compares to others. So thank you.
Yeah, this is a lot of data to digest, but it's good stuff. I'm glad PSC did that. You had Euclid do it. Very lucid. So thank you very much. And Romero, anything following up from you?
No, sir, very helpful. I appreciate Kelsey coming over and give us your perspective.
Thank you, Kelsey, very much. And this work session is over now. Bye-bye.
Thank you.